Again, I'm Brandon Peavy. I'm the chief of the Harrisonburg Rescue Squad. The Rescue Squad, if you didn't know, and for some reason a lot of people don't, is a 501c3 nonprofit organization. What that means is that no one owns the Harrisonburg Rescue Squad. It's a private organization, but technically it's owned by everyone. We operate off donations. Everyone you see at the Rescue Squad, and I do mean everyone, and Harrisonburg Rescue Squad is the only rescue squad like this left, is a volunteer. I'm a volunteer. My position as a chief is a volunteer. I receive absolutely zero compensation for what I do. I volunteer on average 40 to 60 hours a week on top of my normal job. Everyone that you see on a green and white ambulance or a gray car that says Harrisonburg Rescue Squad on the side is volunteering their time. It's very difficult to find volunteers in this day and age and in this economy. However, I've seen it on both sides. I started out as a career firefighter, paramedic, and did that for a living until I started my own ambulance company. So I've been on the side of healthcare in the pre-hospital setting where people are paid to do what they do. You cannot make as big of an impact and find more passionate people than to work alongside with people who are doing it for free. As far as what kind of members we have what we call senior associate members, and then administrative members. So we involve every walks of the community, anywhere from someone my age in my position to someone who's an associate member who can only pull 24 hours a month, to administrative members. The accounting function at the Rescue Squad, we still have to deal with that stuff. We still have to pay bills. We don't pay taxes, but the things that we buy cost money too. The person who comes in and deals with the QuickBooks and things like that, that's an administrative volunteer. The lady who, is anyone here from VMRC? Yeah. Do you know Nancy Pellerin? Okay. Nancy Pellerin is one of our volunteers. Nancy comes in every Tuesday and sometimes every Wednesday, and she writes and signs and mails the thank you letters for people who send in donations for us. So we found something. That was something that she loves to do and that she's good at. And it's one thing that someone my age that has to train and run calls and do something like that also doesn't have to do. So we've really kind of opened up our doors and made use of every resource we possibly can. So the Rescue Squad, a lot of people would say, well, what do they do? Well, people call 911 and they come pick you up to the hospitals. What a lot of people don't realize is the Rescue Squad does a lot more than that. If there is a oil spill today on the interstate from a tractor trailer that wrecked, the Rescue Squad will be there. That's considered a hazardous material incident. If a backhoe downtown today doing construction ruptures a gas line with the pick, the Rescue Squad's going to be there in case the firefighters get hurt while they're trying to stop the gas leak. If someone's rappelling off the side of Massanutten today and gets hung up on a rock, someone has to go get them off that rock. The Harrisonburg Rescue Squad's going to be there and be doing that. If there's a structure fire in the county somewhere today, and there are firefighters there either bringing someone out or just putting out the fire, a rescue squad, and probably the Harrisonburg Rescue Squad, is going to be there. And then if someone at the Highlands today fell and needed help off the bathroom floor, the rescue squad is going to be there and perform that function as well. So we're kind of an emergency room in the field. We don't just, there's an age-old term, ambulance driver. We're not just ambulance drivers. We have emergency medical technicians that go through a lot of training and a lot of clinical training in the hospital setting and outside of the hospital setting. We have what we call intermediates and paramedics, and all of them have the same level of training but can do different skills. And we can do anything in the field from do a surgical crike in your throat. We can do needle decompression. We can do electrical cardioversion to your heart. We can defibrillate your heart. We can intubate you, which is put a tube down your throat and breathe for you. We can do lots of different things, which has kind of evolved our world to where we used to come in and scoop and run to the hospital. Now we come in and we play a lot longer. We call it stay and play. And because we're able to do a lot more things now, which means if we can get those medicines in you, a lot of the times we can have someone who has difficulty breathing, depending on what the reason is, we can have them resting comfortably by the time we reach the ED, just because we were able to provide the interventions that we're trained to do. So our first due area, we run the entire city and about a third of Rockingham County. So basically between the city of Harrisonburg and halfway to every other town. So halfway to Bridgewater, halfway to Grottoes, halfway to Elkton. That's the area that we're responsible for responding to. Now, if Elkton, Bridgewater, or Clover Hill or one of those agencies need help, that's our second due area, then we're going to respond to those two when they request it. So, I always say you should only call for emergencies. So if people are like, can I use the rescue squad for this? Well, if you feel like you're having an emergency and that you think that someone, if you thought that something might happen to you between here and the hospital, if a neighbor took you or something like that, then that's what you should be calling 911 for. Some facilities call 911 when someone has fallen because the security guard or the staff there can't accept the responsibility for picking that patient up and just putting them back in bed because they need someone who's been trained in emergency medicine to actually evaluate that patient. It goes through that process. So that whole regulation and liability thing, again, we don't mind coming out and taking their blood pressure and their blood sugar. Maybe there's a reason that they fell, and we don't want to come into Mrs. Smith's room the next day at 6:30 to find out that she's passed away from something that we could have caught the night before. So that's the kind of stuff is kind of preventative, but we don't mind coming out for that. Well, let's break this down a little bit further. When they have abdominal pain and nausea, vomiting, and if you can picture your loved one sitting in the back of the car with a bag in front of them, and they look sick, they're pale, call 911. Those are the things that we do. If there's not obvious what's wrong with them, then call 911. If there's an assessment that needs to be made, if you can think in your head, I don't know what's wrong with them, call 911. If I walk past this podium and stub my toe and rip my toenail off, and I just can't quit breathing, or bleeding, what's wrong with me. My toe won't stop bleeding. That's not something we call 911 for. That's what a lot of people call 911 for. There is actually a call type at our dispatch center called toe pain, and we can be dispatched for toe pain. Does that make sense? Okay. So if you know what's wrong, if you know exactly what it is, maybe they can go by another means. If you don't know, then that's why we're there. Call us to help you figure it out. Let the dispatcher know everything that's going on. You cannot provide them with enough information. So we have a thing we call index of suspicion. So if you say you're having chest pain and you're 78 years old, then I'm thinking that I'm going to do this when I get there. I'm going to check for this first. If they say that the patient's unresponsive, well, I can be thinking a whole bunch of different things. But my husband's unresponsive and he has a history of diabetes. Well, now my index of suspicion has completely changed, and I'm going to check a blood sugar as soon as I get there. Does that make sense? So I don't need to know that she's on amiodarone and she's allergic to penicillin and that kind of stuff over the phone. We will need to know that when we get there, but provide the dispatcher with everything that's going on. If you have residents that live by themselves and they say, should I put a key outside? Yes. Don't tell anybody about it, but reassure them. They can let the 911 dispatcher know where that key is, and they can let us know, because otherwise, we're going to be paying for a door or a window or something like that. So hide keys outside are very good. Reasonable expectations, you should expect 5 or 10 minutes. Now, these people, this is the worst day of their life, right? Or one of them. When you have to call 911, most of the time, this is one of the worst days. So the time ticks a lot slower. If you've ever been there waiting on the other end, you're sitting in your car at the intersection because someone just rear-ended you, and it just seems like it took half an hour for someone to get there. Don't be mad. It's still just 5 minutes. A fire truck or a police officer or somebody will come. That's the reasonable expectation. Feel free to call the 911 center back, say, where are they? They'll tell you exactly where we are and about how long, because they'll get on the radio and they'll say, what's your ETA? And we'll say 3 minutes, and that way you can actually know 3 minutes. You can sit there and watch the clock if you want to. The snow removal, there's not a huge thing for that. And when it snows, normally we keep extra shovels and stuff on the ambulances. We'll have somebody out shoveling the sidewalk while we're coming in to get you. That's not an extreme thing that people need to be worried about. So this isn't just for elderly people, but clearing furniture. So everybody has your normal house. just like we were talking about ramps earlier, are not designed for stretchers. Houses, people don't put their TV and their ottomans and stuff like that in a way that in case a stretcher might need to come through here one day. So clear the way. If you don't clear the way, we will clear the way. We won't damage your furniture. However, for some reason this is an expectation, we will also not put your furniture back. So if you talk to people and they're like, the rescue squad came, moved all my stuff, and they didn't put it back, those people, you know, they get mad about it. Just explain to them that that's not something that we do. The Harrisonburg Rescue Squad only takes people to RMH. So if you ever have anybody ask you, well, I used to live in Augusta County and I'm used to going to Augusta Health, which used to be Augusta Medical Center. Will the Harrisonburg Rescue Squad or the local ambulance company take me to there because I like going there? The answer is no. We only take people to RMH. If they would like to go to another hospital and it's not an emergency situation, then you can call one of the private ambulances in the area and they will be glad to take you to somewhere else. But due to our resources and logistics, we have to keep our people in this area. Minimize the amount of personal items that you take to the emergency room. People want to take personal blankets, personal pillows, your purse, your special glasses, your reading glasses, and your seeing glasses. Try to leave that stuff at home. If you have like a nightgown or something that makes you more comfortable, then bring that. Otherwise, leave it there. Those items get lost too. Jewelry, watches, rings, take all that stuff off. Turning on a porch light, there's nothing more frustrating than to not be able to see the numbers on the front of the house. Make sure the numbers on the front of the house are actually contrasting colors. Don't put brown numbers on brown brick. Can't see those. Everybody takes little things for granted. Even if you guys go home, look at your mailbox this afternoon. Pretend you're an ambulance rolling up to your residence. If your mailbox is covered by flowers and bushes and can't see the numbers, just because you're not 88 years old doesn't mean you're not going to have to call the rescue squad. It doesn't mean that your grandparents are going to come visit one day and you're going to need to call them for them. If there's a curb in front of your house, take a stencil and write the number on the curb. We look in 3 different locations: the curb, the mailbox, and the front of the house if we can see it. Some people, you can't even see the front of their house. If you can't see the front of your house, buy one of those pretty little signs at Lowe's. They make decorative things. You can put them on cedar posts and stuff. Put that up there. Put your house number, make it visible. Meds and allergies. There is a place and time. It's not when you call 911. It's when we get there. If you can have those on a list, come full circle. When we take you to the emergency room, first thing the nurse is going to ask, one of the first things is, did you bring their medicines? And usually we say no because we've got a list. And if we don't have a list, the hospital has asked us to bring the medicines. The hospital has asked us to bring the medicines because the doctors want us to bring the medicines. They want to know what you're on and what the dosage is. Maintain a list, because what happens is we bring these really, really expensive medicines to the hospital. I don't know who loses them, but they get lost. They do. The medicine fairy comes in and picks them up off the counter and flies away. They fall down in cracks. They fall down underneath the cot in the ambulance. They get lost. And those are expensive. People pay good money for those. So leave them at home. Put everything down on a piece of paper. I need to know if you're going to put allergies. It's really helpful to know what you're allergic to and what it does to you. If you say, I give you aspirin, and you say, it makes my tummy hurt, well, I might still give you some aspirin because you're having a heart attack. But if you say, if I take aspirin, I stop breathing, then I'm not going to give you aspirin. Does that make sense? So what the allergy is and what it does to you. Medical history written down. I'm a diabetic. I have a heart history. I got a stent placed in February of 2006. I got 2 stents put in. I'm on blood thinners. Those are the kind of things that we really, really need to know. And will actually change a lot of how we treat you and what we do. Sometimes what we do first and what we do instead of what we do last. Have emergency contact numbers somewhere on the refrigerator. If we're looking for things, someone came over, you live at Sunnyside, and your friend came over, and they can see you through the window laying on the floor. Well, Miss Smith lives by herself. So we're going to break in. We know nothing about Miss Smith except for the fact that she has a pulse, she's still breathing, and her blood pressure's this. If we're going to go look at the fridge. That's the first place everybody keeps contact numbers. So we're going to look for someone to call who knows about Miss Smith. So contact numbers, even just a piece of paper that says, in an emergency, call Amy at this number, and put a home number and cell phone number. So Life Alert, really, really good thing to have. People are, for some reason, that's one of those things that starts taking away that independence feeling for those kind of people. Just reassure them that this is needed. They make bracelets. They make very inconspicuous necklaces now. There's ways that you can have those on you and people don't even know. Phones everywhere. Need to put a phone in every room. You won't realize just how far away your phone is until you've fallen somewhere in your house, can't walk, and you have to crawl to it. Put a phone in every room. They make these things at Costco now. You can buy a home base, put it in the kitchen, and every other phone is Bluetooth, and you can buy 6 of them. You can literally put a different phone in every room. Fall hazards. No electrical cords across the hallway, across the kitchen. Shower floors, put the sticky things on the floor. Put the sticky things outside the floor. Make sure that there's a rug everywhere, that there's linoleum that they can stand on if there's a chance that their feet might be wet. Put grab bars in the showers. If you're building homes for elderly, install showers that have bars in them to hold on to. So floors and stairs decluttered. Ground level house is extremely important. If you're getting of a certain age and this is the house that you plan on retiring in, I highly recommend a ground level house, something with no stairs. Know your limit. Explain to people's limitations. I have an 88-year-old man that lives next to me. He's in great health. He's the epitome of what I hope that I am when I'm 88. I saw him out the other day, and he's taking a machete and chopping at a tree. Or he'll be up on an 8-foot ladder, standing on the tip top, which we all know you're not supposed to be on the very top of the ladder, washing out the gutters. Educate them. They don't know. Hire people to do that kind of stuff. We talked about the how to key. Okay, so the other thing that I've noticed, has anybody, raise your hand if you've ever sprayed a furniture with Pledge to get the dust off, and some overspray went on the floor, and you somehow in the next couple of days went by that area with some socks on. Does anybody know what I'm talking about? Oh, yeah. Okay, so educate your people about what cleaners they can use. You and I can bust our tails on that kind of stuff. Imagine someone who has decreased balance already, what's going to happen to them. Not only are they going to fall, but they don't have the ability or the strength to catch themselves and those kind of things. It's just, okay. One of the probably most common questions that I get when we come to these places is, why does a fire truck sometimes come? So our dispatch center, the Emergency Communications Center, divides calls into life-threatening and non-life-threatening. If it's considered life-threatening, then they send a fire department as well. Not only because there's more fire departments around than there are rescue squads, and chances are they can probably get a responder or an EMT there quicker than the rescue squad can. But a lot of times, if there's a life-threatening illness, it takes a lot of hands. Not just a lot of knowledge and a lot of skills, but just a lot of hands. To get someone in and out of a house quickly, or to get some people get themselves in the strangest places. People can somehow fall under things. It just takes a lot of manpower to take care of these emergencies sometimes, especially when you get to car accidents, traffic crashes, and things like that. So that's why the fire department comes. Well, the problem with this is that if you've ever noticed on your iPhone or your cell phone, there's an emergency mode, and you can actually dial. You should be able to dial 911 from any phone, regardless of cell phone service. So if you have a Verizon phone, if the next gate that's open might go to AT&T Tower, well, AT&T might forward their 911 calls in a mapped way that ends up going to Appomattox. The thing that's in Appomattox is that Appomattox is the closest state police headquarters to that area. That might be why you were sent to Appomattox.